Why is dental hygiene important to your health? Did you know that your dental hygiene and how you take care of your mouth affects the rest of your body? What causes cavities to form in your teeth, and what should you do to prevent these cavities from forming? In order to protect your own health, I would like to discuss these few questions so that you don't find yourself dealing with health issues that could be prevented from simply taking care of your mouth. Some of the information that we will discuss is basic and you've probably heard before. However, I will share some statistics that you may not be aware of concerning dental health. I have worked in a dental office for almost 11 years now, and as a dental hygienist, I've seen firsthand how your overall health can affect your gums and your teeth and vice versa. With the many continuing education classes and seminars that I've had to attend, I have learned a great deal about this topic just since finishing my training in school for dental hygiene. Taking proper care of your mouth is a very important thing to your entire health. There are a few simple steps to developing habits that will allow you to do this. Today I'm going to discuss the importance of dental hygiene and how the bacteria in your mouth affects your health, how cavities form, and finally a few steps to maintaining good oral home care to prevent health problems. The first topic we'll discuss is good oral home care is important to your overall health because the bacteria in your mouth affects your overall health. On a website from Fox News, according to the American Heart Association, research has found that professional dental care, such as 2 cleanings per year, and proper home care can reduce the risk for having a heart attack or a stroke. Your oral health can also affect and be affected by other conditions such as cardiovascular disease, pregnancy and birth, diabetes, AIDS and HIV, osteoporosis, Alzheimer's disease, and Sjogren's syndrome. Many of these diseases can actually cause your body's lower resistance to infection, which would cause more severe oral health problems. Just the same as many areas in your body, your mouth is full of bacteria. Most of it is normally harmless to your body, but there are some bacteria in your mouth that can cause gingivitis, and if left untreated can eventually lead to periodontal disease or gum disease, which as a result could also lead to a loss of dentition. For this reason, it is very important to keep these bacteria under control. So now that we've looked at how bacteria can affect your overall health, let's look at how cavities are formed and how the bacteria plays a part in that. Dental cavities are one of the most common conditions in America today, according to a Dental Hygiene Monthly article that I read on adh.org. It is also the most common disease in childhood today. According to the Center for Disease Control, also known as the CDC, more than 19% of children today have untreated cavities. At least 41% of these cavities are in baby teeth or deciduous teeth. So how are they formed? The bacteria in your mouth produces acids which breaks down the enamel when they digest sugars and starches in your foods. In addition to the bacteria, a sticky substance that forms on your teeth called plaque is formed from the bacteria, and when that plaque is left on your teeth for an extended amount of time, cavities are formed as the enamel begins to break down. So what are some effective ways to prevent cavities from forming? The main steps of preventing cavities is things such as brushing, flossing, and rinsing at least 2 times per day. Another technique that helps aid in this is the use of fluoride. Fluoride is a substance or chemical that interferes with the breakdown process of the enamel, which is also known as the beginning stages of cavity formation. Most toothpaste and mouth rinses contain fluoride in them. This chart actually shows a couple of different pictures. There's one with braces at the bottom. Anyone that has braces, it's very important to use fluoride because it's so much more difficult to clean your teeth when you do have braces on your teeth. Some of the others, it just shows some cavities around the gum line, and basically this is just giving some statistics about people's age and what percentages have have cavities and what could help with that. How fluoride can help prevent those things. In the 1950s, the U.S. Public Health Service began adding fluoride in the drinking water. Although there are some communities who opt out of adding fluoride to the community water, it is still actually recommended that you drink tap water rather than bottled water to help aid in the application of fluoride. This fluoride can also be found in mouth rinses, mouthwashes. Most toothpastes on the market that you can buy also contain fluoride in them. According to research, brushing your teeth at least 2 times a day for 2 minutes at a time is the most important method for removing plaque and preventing cavities, gingivitis, and other diseases associated with plaque. Proper brushing technique cleans the gums and the teeth effectively. The next step is flossing. Although brushing is very important, flossing is the most important because there are areas in between your teeth that your toothbrush bristles cannot get to. For this reason, I recommend myself to my patients that you floss first and then brush. Most people do it the other way around. The reason why is because once you have flossed and gotten the food and debris out from in between your teeth, then you can brush your teeth away, brush the cavities and the plaque and debris away from, rather than brushing your teeth and then flossing and mixing them up again. The flossing enables you to clean the food debris and plaque, thus preventing cavities from forming in between your teeth. As a hygienist, we find many patients have cavities that form in between their teeth simply because they don't floss. They don't take the time to floss. They brush really quick and go. So after you have flossed and brushed your teeth, the final step that we will look at is rinsing. While brushing and flossing is very important, and it only kills the bacteria that's on your teeth, whereas rinsing your mouth out each day with an antimicrobial rinse such as Listerine or Scope, the rinse will allow you to kill the harmful bacteria in the entire mouth. When shopping for a mouth rinse to use, you should always look for the ADA seal of approval on the bottle. This just means that the product has been tested and approved by the American Dental Association. The product that we recommend the most is the Listerine, and this is a new flavor, so I couldn't find the ADA seal of approval on this particular bottle, but this is what we use typically, what we recommend for patients to use. So, as you can see, proper oral home care is very important to your overall health. Obviously, there are benefits to developing habits daily and consequences for neglecting those as well. Proper dental home care can prevent other health-related issues in your body, and cavities are formed by the presence of plaque that is not cleaned off your teeth. Some simple steps to prevent cavities include flossing first, then brushing, and then rinsing with an antimicrobial rinse such as Listerine or Scope at least 2 times a day. With all of the dental products offered in the stores today, this is a very simple yet important factor in taking care of your overall body. As a dental professional, we see patients come in our office every day that suffer from dental health issues such as diabetes and heart problems, and we see firsthand the effects that the disease has upon the gums and the teeth and vice versa. So from seeing these patients and how their overall health affects their teeth and the gums and vice versa, proper dental home care is definitely a plus.